So again, my name is Dr. Ron Bufard, and today I'm presenting on behalf of Align Modern Health the importance of sleep and stress relief and how the factors impact our immune system and our ability to stay healthy. So here at Aligned, we are integrative, or our approach is integrative. We kind of look at the whole body and try to develop personal plans that are really customized to you to fit your treatment goals. We kind of look at the body in several different forms. One is through the chiropractic physical medicine. I think that's pretty self-explanatory. We offer acupuncture and Chinese medicine, also very good for women's health, gastrointestinal disorders, endocrine issues, and certainly infertility. We do offer massage therapy as well, which is really great for stress, anxiety, some of the stuff we'll talk about today, headaches, fibromyalgia, as you can see, and then the functional medicine or clinical nutrition side, which is really more geared towards sort of systemic involvement and how we can help treat the body to become more optimized in its function, hence the name functional medicine. And of course, our delivery is using mainly nutrition or nutritional supplementation. Again, my name is Dr. Ron Bufard. I have been with Align Modern Health for the past year. However, I've been practicing functional medicine for the past 10 years in Maine. And of course, I am a chiropractor. I've been practicing that for 25 years. I am the Director of Practice Development with the American Chiropractic Association Council on Nutrition. I have two board certifications, one as a chiropractic internist, which is the functional medicine umbrella under chiropractors, and then as a certified clinical nutritionist as well. So, how can sleep keep us healthy? Does sleep really keep our immune system strong? It seems like such an easy thing, and the question is how do we connect or correlate? How is sleep really integral in our, need to be healthy? So, primarily, when we sleep, we are really nurturing our bodies. So I tell people it's the healing and repair phase. You have to sleep at night so your body can kind of shut down and then spend all of its energy trying to heal and repair. This is also the case for just the immune system. We need to rest so that the immune system can rebuild itself from the day's activity. When we don't have enough sleep, we make less cytokines, which are a type of protein that target infection and inflammation. So cytokines are not directly the molecules that actually cause the immune system response, but they're the flaggers. So if there is something going on, it's a cytokine that will go and find something and then say, hey, body, let's produce antibodies. So when we aren't sleeping well enough, our body isn't creating enough of these cytokines, which then just makes healing, repairing, and then overcoming any kind of infection difficult. And that's what this screen is all about. Chronic sleep loss makes the flu vaccine even less effective by reducing the body's ability to respond. So what is chronic sleep loss? Anything less than 7 to 8 hours per night for adults, 9 to 10 for teenagers, and 10 hours usually for children in school is what is considered, or the recommendation, and at least 2 hours of uninterrupted REM sleep. So when you have chronic sleep loss, your cytokines aren't available, they can't say to the rest of the body, we've got a problem over here, come take care of it. There's also great research that suggests that poor sleep increases pain sensitivity, and then therefore also raises the likelihood of developing low immune responses. So again, just sort of piggybacking off what I just discussed, when we do lose sleep, we become a little bit more sensitive to pain. So if you have the flu, which usually incorporates aches and pains, you will actually have worse symptoms. And then these inflammatory mediators, because they're so lacking, create the inability for the body to overcompensate and makes this low immune response that we're talking about. So the good night's sleep can boost the effectiveness of certain specialized immune cells called T cells. Now, T cells are all part of the system that really deals with viruses predominantly. And again, when we get a good amount of sleep, our body can actually heal, repair, and create more T cells. And when we don't have enough sleep, we aren't able to overcorrect and create a healthy immune response. So again, looking at colds, flus, any viruses that we're talking about, you're more susceptible just by having less sleep at night. However, during the day, if you've had a really terrible night of sleep, taking 2 30-minute naps, one in the morning and one in the afternoon, has been shown to help decrease the stress and offset the negative effects that sleep deprivation has had on the immune system. Now, in our world, of course, taking 2 30-minute naps is probably not something we could all do. However, what I usually try to recommend to people is through your day, you're usually entitled to 15-minute breaks. And what we recommend is really twice daily, just taking that time to either work using mindful meditation, just relaxation techniques, whether you use an app to really just kind of walk away from work for a little bit, close your eyes, try to put yourself in a good space, help you to sort of bring down the stress. You become a much more effective employee that way. There are several companies that recognize, a lot of telemarketing companies recognize the benefits of that, and many offer the opportunity when you work after 4 hours of continuously being logged in that you have to log off and then do stretches or mindful meditation or just breathing. So something that we should all consider in our normal workday. It will just help us improve our immune system. Clearly, this dog with the nice butterfly and the larkspur in the background has a really great immune system. So there are hormones that really affect the sleep and wake cycle. Dopamine is a regulator of activity. It's what keeps us up. It keeps us focused and alert, and it creates that motivation. Dopamine decreases melatonin. And melatonin, of course, most of us know, is one of the neurotransmitters that actually helps us to downregulate in sleep. Serotonin also is a precursor to melatonin that helps us to maintain sleep. So those are the two primary effectors. Norepinephrine, on the other side, also is more attention, balance, mood, concentration, clarity. So dopamine and norepinephrine work opposite of serotonin. And so if you have too much dopamine and if you have too much serotonin, you can actually prevent you from falling asleep and going into that REM cycle. There's a known fact that with serotonin levels, especially people who are on anxiolytic medications that are called SSRIs, that we can actually create worse effects with sleep simply because serotonin sits on a receptor for too long and doesn't allow for our bodies to actually go into a deep sleep. So the balance is really a struggle. Like I said, our goal is really to try to increase our serotonin for the production value of the melatonin, and hoping that we can keep it there. So what kind of foods can we actually utilize or enjoy that might help us in the creation of the serotonin that ultimately will create more melatonin? And these are what you see right here. Eggs, high in tryptophan and omega-3s. Cheese, again, a tryptophan-derived product. Fresh pineapple creates one of the few vegetables that we have, or fruits in this case, that actually increases serotonin. However, the longer that the pineapple ripens, the less serotonin. So we really have to get a very fresh pineapple to get the effect of the serotonin increase. Tofu, salmon, nuts and seeds, and turkey all have high levels of tryptophan. Tryptophan is an amino acid precursor to serotonin that then creates the melatonin. So just by increasing these foods, certainly in the evening, could certainly be helpful in helping you fall asleep better. Foods that actually contain melatonin in the first place. Almonds. Not only do they contain melatonin, but they also contain magnesium and calcium. Magnesium is necessary for smooth muscle relaxation. Many of you probably are also aware that it does help with just sleep. It can also help for digestion, especially if you are constipated, because magnesium helps to kind of relieve that. And then calcium is one of the necessary elements for muscle contraction. So likewise, in calcium and potassium and magnesium, these are the three big hitters as far as macronutrients that we really need to help to have muscle relaxation. So milk, it's not an old wives' tale. Milk contains tryptophan, calcium, and vitamin D, as well as melatonin. So when you heat it, it activates it even more. So having a warm glass of milk just before bed, having an ounce of almonds, both of those things can help increase your sleep. Kiwi, so 2 kiwi, very specific, increases the potassium, the magnesium, folate, calcium, and anthocyanins. Also has melatonin. The only thing that I can add to, you've already heard me talk about potassium, magnesium, and calcium, is that folate is really good for neural transmission, neural meaning nerve transmission. So it helps us to kind of down-regulate again and make the brain go quiet. The anthocyanins, on the other hand, are just really great. They're really great products that help to kind of down-regulate the body systems by giving you variety. Tart cherry juice. Now, this is something that many of you may have been exposed to recently. It definitely has melatonin, but it has magnesium, tryptophan, and serotonin. So it's sort of a triple threat. The problem with tart cherry juice is it has to be unsweetened, because if you add sugar, you're actually going to sort of increase the body's potential of having to upregulate and deal with the sugar. And of course, if you have any infections going on, any bacterial infections, sugar really feeds into that, and that actually causes an uptick. So it might make you a little more upset at night specifically. So make sure if you are doing tart cherry juice, no added sugars. And lastly, walnuts, 100 grams. So we're talking maybe about 4 or 5, or just, about a third of a cup. Magnesium, folate, calcium, and potassium. We've talked about them, and melatonin. And of course, omega-3 as well. So any of these foods that we're looking at here can help, especially even closer to bedtime, to help us kind of get into that sleep mode. Chamomile tea does have this opportunity for flavonoids, apigenin, and activates GABA. So GABA is one of these neurotransmitters. It's inhibitory. It helps the mind to relax. It helps you to fall asleep and stay asleep. Apigenin is an interesting molecule. It binds to receptors to decrease anxiety and initiate sleep. So having a cup of chamomile tea just before bed helps to get you into that sleeping mode and helps to keep you sleeping at night because of the activation of GABA. And of course, on the opposite side, you see that 3 ounces of fatty fish. We're talking salmon, swordfish, tuna, sardines. Any of those high fatty fish end up with lots of potassium, magnesium, and phosphorus. Zinc, really good for the immune system. B12, it is an energy regulator. Folate, of course, I've talked about, helps to kind of downregulate the nervous system. Calcium, again, necessary for muscle contraction. And then it just helps to regulate the serotonin. So 3 ounces of fatty fish, that being about the size of a deck of cards, is really what we're talking about. So having a dinner of 3 ounces of fatty fish can help us that night in trying to get a better night's sleep. Now let's switch roles and let's go to how stress affects the immune system and what we can do to actually change it. So stress is really interesting because stress comes from a lot of different ways. It can be mental stress, it can be physical, it can be environmental. So when we are stressed, the immune system's ability to fight off and to utilize antigens is reduced, which is why we're more susceptible to infection. So when we are at work and really having everything coming from all sides, if we don't take any time at all to sort of downregulate that, we actually lower the body's ability to respond to infectious processes. This is what this first sentence here. Stress decreases the body's lymphocytes. Again, lymphocytes are, T cells are one part of the lymphocytes, but lymphocytes are white blood cells that are very specific to fight off viral infections. When you lower the lymphocyte level, you're more at risk for the viruses, including the common cold and cold sores, amongst other things. So having too much stress will certainly decrease your body's ability to fight off these viruses. Now, high stress levels can now cause depression or anxiety and or both, and leads to higher levels of inflammation. And this, in the functional world, is really where we kind of roll. Everything is usually about systemic inflammation and where it comes from. Inflammation can come from immune system challenges, but it can also just come from too much stress. Long-term sustained high levels of inflammation point to an overworked, overtired immune system that cannot properly protect you. Stress hormone is cortisol, comes from the adrenal glands and suppresses the effectiveness of the immune system by lowering the number of lymphocytes. There's a couple of different studies that were done years ago that I studied. One of them was talking about depression after someone has passed. So the study looked at people who were in long-term relationships, and one of them passes away. And the surviving partner ends up with a lowered immune response that actually was measured by looking at blood work to see, and seeing that they actually had less ability to overcome disease, which is why sometimes you see people who have been in long-term relationships, and when a partner dies within 6 months to a year, the remaining partner ends up either coming very sick or can even pass. It is not rare at all. It is actually very demonstrable in blood work. How do we really deal with it? We really have to find steps to reduce the short-term and the long-term stress. So one is meditation or mindfulness. I mentioned it earlier, talking about just taking 10 to 15 minutes just to kind of get away from work or the environment that is causing the stress. It helps to, doing meditation will help to lower your stress. It will reduce your cortisol levels dramatically. With that, of course, reduces the inflammation. And it helps to break down chromosomes that lead to cancer and premature aging. So I like telling you that because it seems like such a simple thing. It seems like, how could that possibly be helpful? But we know from looking at genomic studies that we can actually break down some of those cancer genes and increase your ability to age more gracefully, simply by giving you a little bit more vitality. There are great apps that you can use on your phone: Calm, Headspace, Insight Timer, 3 of my favorite. All of them have free options available, so you don't have to spend any money. If you want to get a little bit more fancy, you can spend some money and get into some deeper ways of actually finding just meditation. The good thing about these is they kind of direct you through them. There's some people like, I don't know how to meditate. I don't know how to sit down and make my mind be quiet because in my head I'm thinking about everything I have to do at work. When you're using an app, the app is directing you to kind of either pay attention to your breathing or pay attention to where your body is in space. So now you're focusing on what you're hearing and your body, and not so much about everything that's going on outside. It's a great technique. It's certainly applicable anywhere. And if you are at work in an environment that is very stressful and you have break times, it's a good opportunity to just put your headphones in and turn on Calm or Headspace and just find a nice little, dark area that you can go and just do some meditation or some mindfulness. Now, yoga is also another form of sort of de-stressing, especially hatha or restorative. And so the practices of hatha, restorative, or deep stretch yoga helps, again, lower cortisol, that stress hormone we talked about. It will help to calm your nervous system and help to reduce the inflammation by simply just making your body a little bit more aware with movement. You also have to recognize that lymphatic channels are what really bring all of the junk in our system out. And so they don't have really good muscles to have that movement to happen. We have to manipulate them. And so when you are contracting a muscle, you literally are squeezing some of those lymphatic channels and helping to move the inflammation out of your system. Usually when you're practicing yoga, you also incorporate some deep breathing. Helps you to actually maintain poses, but it also helps you sort of down-regulate those stress hormones. And when you breathe, you're actually reducing a lot of the toxins that are gas in your body. Again, circulating the fluid through your lymphatic system filters out toxins, especially with the inverted poses, because gravity plays a big role. As I told you, the lymphatic system does not have really great muscle structure. So for you to invert is going to cause all of everything to kind of go the opposite direction that it's used for. So I want to point out other forms of yoga like vinyasa or flow practices, power, cardio core, any of those, hot yoga, they're wonderful for the body, but not when you're sick or under a lot of stress, because you're just going to be adding more stress. You do have to find that balance. So when we are seeking stress relief, the slower restorative practices are highly recommended. Same thing holds true for exercise. Exercise is both a stress relieving activity as well as a friend to the immune system. So acute exercise boosts the immune system to improve defense activity and metabolic health. Habitual exercise improves immune regulation, delaying the onset of age-related dysfunction. So what do I mean by acute versus habitual? So acute is I'm going to go and I'm going to do a 30 to 40 minute exercise program, and I'm going to give it my all. You're definitely going to change how your body's metabolism is working. At the same time, your body, because you are in the process of the exercise, you're actually causing a little bit of cellular damage and destruction. Your body suddenly has to kick in, and that's where your immune system becomes very effective. However, doing very long exercise, an hour and a half to 2 hours, or doing something pretty extreme, marathon running, actually does create a lot of inflammation and stress to the body. That's why you need to train for stuff like that. Habitual exercise is really just meaning that if you implement a plan of 3 to 4 days of exercise a week, you're going to help the body maintain its tone and structure. You're going to help movement, and again, increase circulation of your body and your lymphatics. And doing it regularly without putting a lot of extra stress to your body just helps to keep your body much more regulated in all aspects, with respiration, with digestion, and hopefully with hydration as well. So there's a couple of studies that talk about the anti-inflammatory influence mediated through multiple pathways of exercise training. So we know that there is a clear inverse relationship between moderate exercise training and illness risk. So what does this really mean? Endorphins from exercise reduce stress because they're the enhancers of your attitude, endorphins. Exercise is unique that it can boost our mental health, and this is where the endorphins come from. And during this anxious time, more important than ever for our minds to keep clear and focused. The other thing is that as we age, our bodies definitely need more movement, and simply again for the idea of creating more circulation and more lymphatic training. So if we are really good at keeping up an exercise regimen, say 3 to 4 times a week, of just getting out, and even just a good brisk walk to get in some steps, can really help to keep the body clean and clear. Keep in mind that all of your joints, as a chiropractor, I used to tell all my patients, your joints are like hinges on a door. And as we get older, we have more oxidation of those hinges, which is what rust is. And then it becomes a little harder to keep moving those hinges. But if we keep moving the hinge every day and we keep oiling it by giving it anti-inflammatories, in this case, I think anti-inflammatories as fish oil or glucosamine and chondroitin sulfate. These are things that you can help to kind of prime the hinges. And then moving it every single day does not allow the accumulation of oxidation to continue. So doing exercise regularly will also help just keep you more vital and young. Now, this screen here talks about when we don't suggest exercise, specifically when you have a cold, mostly upper respiratory, where you're having difficulty breathing, or if you have any kind of chest congestion with a lot of phlegm, because these only add stress to your body because you're not able to take in the oxygen that your body needs to produce activity, and then you run the risk of actually increasing the stress load and making your immune system kind of tank. So if you feel sick, you should rest, you should hydrate, and if, of course, you're having any of these symptoms, that are prolonged, you should definitely seek out medical attention. I want to thank you for joining me. If you have any questions, you can add them right now into the Q&A feature. If I don't get to answering any of all the questions today, you can always call for a free 15-minute consultation. The number is right on the screen, or you can visit us at alignmodernhealth.com and request a free 15-minute consult with myself or any of the other providers that we have. I wanted to point out to you that insurance does cover some of what we're talking about here at Aligned. You can see Blue Cross, Blue Shield, and Aetna cover both chiropractic, physical medicine, acupuncture, functional medicine, and nutrition. Furthermore, if you are of the VA, United Healthcare, chiropractic, physical medicine, and acupuncture is covered. Cigna, again, acupuncture is covered, and then Medicare does cover chiropractic as well. I'm going to leave this up here, and I'm going to go take a look at some of these questions and answers that are coming in. So, yes, Terry, the deck will be shared with attendees, whether you attended or not. So, absolutely. Can this webinar be shared via email or the notes? I know that they're going to share it to you via email. I believe that once you have it, you can probably attach it and send it to somebody else as well. Do you take Medicare at Aligned Modern Health, and what office am I in? So we do take Medicare, but it only does cover the chiropractic physical medicine. So if you wanted to see me as a functional medicine doctor, you would have to be paying for it out of pocket. I am at the River North office currently, and that's where I will be going forward. Any advice on counteracting the drowsiness side effect of my SSRI? I've tried taking it at different times of the day. Yeah, so again, any of those foods that we're talking about will be helpful in at least increasing that serotonin. It's a tough spot to put you in. What I will say is we should probably talk about this from a different angle. If you wanted to reach out to me specifically and get a 15-minute consult, we can probably talk. It's a little too personal probably to chat about like what medication you're taking and how best to deal with it. Do you have any other herbal recommendations for anti-inflammatories for calming effects than chamomile? Yeah, I have a lot of them, but my problem is sort of, I really personally prefer that we cater it to what we need to. I will say for the most part, anti-inflammatories, I love fish oil and vitamin D. Those are the two things. Fish oil you can't really overdo, but you can overdo vitamin D. And this is where, you know, meeting up with me perhaps, or one of the other providers can certainly help you. Blue light from our devices affects our brain's ability to produce phytochemicals. Yeah, good point, Alex. I didn't even bring up blue light, but yeah, we recommend that anytime after dinner that you actually get blue light filters or glasses. Because our devices do actually emit the blue light, which actually causes an increase of the dopamine in our brains, which makes it much more difficult for us to sleep. So great point. Didn't bring it up at all, but I'm happy you did here. I definitely recommend it on your phone. If you have a phone that allows that blue light filtration, you can set it up. That's what I've done. And if you have a smart television, same thing. What are the chiropractic practices, methods, apart from diet, you are using for helping sleep? Yeah, so chiropractic, I'm glad you bring this up because I didn't talk at all about chiropractic, but for the most part, it's going to be probably a lot of upper cervical. I'm guessing that the most likely area where you're probably going to see anything is going to be in the neck and shoulders, because that's where most people hold their stress, and that's usually what keeps them up at night. But again, when we work with people here, we really try to tailor very specifically with what your symptoms are and then what we find in our findings. But from my own personal experience, most people who have sleep problems also, what I find is mostly in this upper cervical area, headaches, neck and shoulder tightness, etc. I've always been a night person who has the most motivation and energy at night, and I'm tired in the morning, and I've struggled with motivating myself to go to bed at a reasonable time in order to get enough sleep for work the next day. So usually I'm sleep deprived every day at work, only to wake up again. Any advice? Yeah, so this is classic. I have several patients that I am working with this. It's really, your circadian rhythms are a little off, it probably has a lot to do with that adrenal gland thing we mentioned and cortisol. Because cortisol is what wakes you in the morning, but it should be very low at night. And I'm guessing it's reversed in you, and this would be something that we could test and then determine how best to really treat. Joined late, can you please share the recording with registered attendees? Yep. Everybody will get a copy of this, whether they attended or not. So we're good. I've heard drinking lots of fluids before bed also makes it difficult to sleep. Is that true? Well, it will, only because it will make you have to remove those fluids. So that's the bigger problem. I usually recommend that after 8 o'clock, we try to taper down on the fluid simply because it's just going to make you go to the bathroom. What are your recommendations for teenagers having a hard time falling asleep? So again, this might be one of those circadian rhythm, adrenal gland, stress issues. This would be something I would suggest that we either get a 15-minute consult on and discuss what the specifics are and whether or not we can really work with you a little bit more specifically. Do you have any recommendations for things to take to help get over COVID or possibly not get a bad case of it? Yes, I do, but this is not what this particular, this was not what this was about. What I would suggest, Terry, is that same thing. Reach out to us for a free consultation. I'd be more than happy to discuss some of the things that are open right now and that we know. And we certainly would be happy to help you with any of that. It's a pretty simple list. You probably know many of them already. If there are no more questions, I do want to say thank you so much for giving me the opportunity to speak with you about this really important subject. I see it all the time in my practice here and know that sleep is really difficult, especially in these times. I want you to know there are many different ways. I've given you a lot of really good information about some foods that you could certainly look towards incorporating. And again, if you're still having a little bit more trouble or difficulty, please reach out to us. Either for a free consultation, you just call on that number, or through the website and ask to speak to any of the functional medicine providers. Most of us are doing everything telemed, so you do not have to come into the office if you do not want to. We can certainly, like I said, give you a free 15-minute consult and then determine what the next steps would be for you. Again, thank you so much. Enjoy the rest of your day.